So this is on chapter 5. This is our third day on chapter 5, and this is the recording for Wednesday, October 7th. There was Google work, or welcome work on Google Classroom that the students started out with. So we are talking about contracts, and it is an agreement between two or more parties. There's three parts to a contract. There's the offer, which is a healthcare facility or provider has a treatment or service they can offer to a patient. And then a competent individual offers to be a patient. So I may find, if I'm a patient, I may find a healthcare facility that offering the services that I need, and then I offer to be a patient. Acceptance is when the patient makes an appointment with the healthcare facility or provider, or the provider and accepts the treatment or services offered. The individual is accepted as a patient. So once I call to make an appointment, I'm offering myself to be their patient, or I'm accepting to be their patient, and once they take my appointment, the facility is accepting me as their patient. There's also the consideration, and it's the patient receives the treatment or the services, and then the payment is received from the patient. So the consideration is when I actually go to my appointment and they evaluate and treat me or whatever else they may do. And then also when they receive money from me, that's part of the consideration also. So the implied contract is obligations are understood without verbally expressed terms. So an example is a healthcare worker gives patient medicine and the patient takes the medication. So, and when that's the case, when a nurse gives a patient medication, they don't have to sign any written agreement that they agree to take the medication. Once they take out of the nurse's hands, put it down their throat, and swallow it, then they have implied their contract that they are taking the medication. Express contract is stated in distinct and clear language, either orally or in writing, and it's usually in writing. So an example of this is surgery. They have to report all risks must be explained for the surgery. So if I was going to go in and have maybe make my stomach smaller with the lap band surgery, then they would have to go ahead and explain all the different risks that could be possible that might occur during the surgery, or even afterwards before I can have the surgery. A person who has a legal disability does not have the legal capacity to form a contract. So examples are minors. As a minor, you cannot go into a hospital and say, hey, I want a new nose. Please do a nose job for me. Mentally incompetent person. So I have my uncle who lives with me who's mentally impaired. He cannot go into the hospital and sign a contract or ask them to do any type of procedure on him. I have to sign for it, or my mother has to sign for it. And also, like when he does have to go to the hospital, I can't just tell them, hey, I'm his legal guardian and I have to sign for him. I have to take in my court papers that say and report that I'm his legal guardian. Individuals under the influence of drugs that can alter their mental state, and then semi-conscious and unconscious people, of course, they cannot sign a contract. So in that case, if they're admitted or with somebody, then they would sign the contract for them. Such cases, parents, guardians, or others are permitted by law and must form the contract for the person. There are certain standards of care that must be provided by competent and qualified individuals. There is a breach of contract if it is not performed according to the agreement. So obviously, this is a case that would never happen, but if I went in to have surgery to get that new nose that I want, and while they're in there, they're like, hey, something's wrong with your leg. Let's fix that leg while we're in here. That would be a breach of contract because I did not approve them to do anything to my leg. So obviously, that's not something that would occur. In class on Tuesday, we talked about the doctors who were diagnosing children with epilepsy, excuse me, and then diagnosing adults with cancer. So those would be, that would be a breach of contract because they are giving improper care to those patients. So those would be an example of a breach of contract also. So when there is failure to provide care and or give improper care on the part of the healthcare provider. Also, failure on the part of the patient to pay according to the consideration is also a breach of contract. So when you go to the doctor's office, you sign something saying that they will be paid. So if I decide not to pay, then legal actions can be taken for that or any other type of breach of contract. There can be legal actions. This would be a breach of contract. Can you give me one more chance, the doctor says, and the patient says, doctor, you amputated the wrong leg. So that would be definitely a breach of contract in this situation. If there is a non-English speaking person, the law mandates that an interpreter or translator must be used when a contract is explained to a non-English speaking individual. Many states require an interpreter for individuals who are deaf or hard of hearing also. So in the case of a non-English speaking individual, I cannot stick an English contract in front of them and have them sign it and have it be legal without having them interpreter there and explaining what it all means. Those who are deaf or hard of hearing, they may read the contract themselves, or they may be able to read lips also. So they may do that, but they may still need somebody to interpret to really tell them what the contract means or what the risks are involved for the procedure. Most agencies will have a list of interpreters who can be used, and they don't have to use an interpreter that the agency contacts. They can bring in a family friend or a family member that could interpret for them also. When a person works under the direction or control of another person, the employer is the principal, and the person working under the employer or the employee is called the agent. So the employer is the principal, and the employee is the agent. Now, the principal is responsible for the actions of the agent and can be required to pay or compensate people who have been injured by the agent. So yesterday we watched a video about a boy who went into the hospital and he stopped breathing and his heart stopped and he did not receive enough oxygen to his brain. So as a result, he left the hospital with cerebral palsy. Now, the family sued, and they sued the principal, which was the hospital. They did not mention that they were suing any of the agents or the nurses or the staff that were there with the boy at the time. So in this case, the hospital was responsible for what their employees or their agents did at the time, or the lack of treatment that was given to the boy during that time. So Owasso Memorial Hospital would be considered the principal, and then the agents are everybody who works for Owasso Memorial Hospital. If a dental assistant tells a patient, your dentures will look better than your real teeth, the dentist may have to compensate the patient financially should this statement prove false. So you don't want to tell your patients anything that may not come true. You may certainly hope that it comes true, but sometimes when working with the body, things don't work out the way we want it to. So as a paramedic, if you go to pick up a family member and you tell the family, you know what, they are going to be okay, we are going to do everything that we can, and it looks like they're going to be good. I don't think you'll have any issues. You'll see them at the hospital and everything will be good to go. But for whatever reason that patient dies, then those paramedics are liable and legal action can be taken because they told the family members that everyone would, that the patient would be okay. As an occupational therapist, if I worked with someone with a shoulder surgery, I never told them that they would have full range of motion in their shoulder. I may do everything correct, but let's say the patient, maybe he's non-compliant. He doesn't do his exercises. He doesn't wear a splint. He doesn't. He uses his arm more than he's supposed to, and therefore he does not get the full range of motion. He could sue me because I told him that he would have the full range of motion, but in reality, it's his own fault that he doesn't. So in cases like that, I would often tell my patients that I was hoping, and it was my goal to get 50%. I never even promised that we would get 50% range of motion because you never know what could happen, either due to the patient or due to the type of surgery it was or whatever the case may be. So you don't promise your patient something or your family members that you don't know will be 100% true. In most cases with the body, you never know if it's going to be 100% true or not. Healthcare workers should be aware of their role as agents and work to protect the interests of their employers. So you want to keep your job, and you want to make sure you represent your employer well, and that you do what you're supposed to, and knowing that if you do something wrong, it doesn't only affect you, but it also affects your employer. So this is kind of off topic of what we're talking about with the contracts, but just an interesting topic, Huntington's disease. It creates all kinds of problems for patients. They have trouble talking. They have trouble walking. They eventually are not able to eat or to feed themselves. They lack impulse control. They lack flexibility. They get stuck. They fall. All kinds of things. I do have family members who have Huntington's disease. So after this, there are 2 videos that talk about Huntington's disease. The first one is about a gentleman who's young. I think he's 34, and he has Huntington's disease, and you get to see how he talks and how he moves in the video. The next one is actually a movie clip from Scrubs. I just showed half of the movie clip to the students in class, but go ahead, and if you want, you can watch the whole thing. I will not show the movie clip here during this recording, because you'll be able to see it, but you won't be able to hear it. So go to Google Classroom and look up the Google Slides for Chapter 5, Day 3, and you can find those clips and you can watch them. After watching the clips, we talked about whether or not students would want to know if they had a disease, if they would want to be tested to see if they do have that disease or not. We also talked about is it right to have children biologically, knowing that you have a 50% chance of passing on that disease to that child? Do you have to talk to your partner about whether or not you want to have a child, knowing that there's a possibility that they may have this disease? Or is it just the woman's decision to decide whether or not they're going to have the baby or not, or have a baby? We also talked about what you would do if you knew you had the disease. And also, should it be mandated that if we know somebody has a genetic disease, for them to be tested prior to having children? And if it is, it's a high chance that they would pass that gene on to their children, should they not be able to have kids? Does that infringe onto a patient's rights? So just some questions to think about as you watch the video, or after you watch the video, to think about some of those questions for you. So we're going to skip a couple slides here and go right into privileged communication. All information given to healthcare personnel by a patient is privileged communication. By law, this information must be kept confidential and shared only with other members of the patient's healthcare team. So let's say I work at Owasso Memorial Hospital and I work on the 5th floor, and I decide I'm going to have lunch with somebody on the 2nd floor who is a nurse and works on the 2nd floor. And as we're having lunch, I just have to talk about this patient, tell them some of their problems that they're having, or maybe that they're annoying, or maybe that they're great. But I'm telling them some personal and privileged communication that they have told me, and I decided to tell this nurse. Now, she's a nurse, so she knows that she can't talk about it to anybody else. So is that right? Am I able to do that or not? So I should not be telling other healthcare providers about patients I'm working with, because it's on a need-to-know basis. And if they are not part of the team that is working with that patient, they should not be told about the patient. Now, if I go to somebody and I ask questions, because I know this particular nurse is really good at this particular situation to get help, then that would be okay. But if I go just to vent or to get it off my chest or to talk to someone about it, that is not right, and that is a violation. So I did work for a home care company for just a very short time. There are many things in the home care company that I wasn't too happy about with the way they did things. But one of the things they did is when they would email about a patient, instead of just emailing the few people that were on the team, they would email the whole home care department. So that would certainly be a HIPAA violation because the whole department does not need to know what's going on with that patient when they are not seeing that patient. So that's one way. Just an example of how that's a misuse of the privileged communication. Cannot be told to anyone else without written consent of the patient. So let's say a husband goes to the doctor's. He has his doctor's visit, goes home, and decides not to tell his wife anything of what went on at the doctor's visit. So the wife calls the office and says, "Hey, I'm Mrs. So-and-so, and my husband was in, and he seems to have forgotten everything you told him, and if you could please tell me what's going on, because I'm his wife and I need to know what's going on." Can the person who answers the phone, or a nurse who, if the phone's given to a nurse, can they automatically tell that wife everything that's going on with that patient? They're married, so they should know everything about each other, right? That is incorrect. Just because they are married does not mean that the husband wants to share his information with his wife. They would have to be on file that he has given permission to tell his wife information if she calls. So when that's the case, you have to make sure it's written out in someplace that the husband or whoever has given permission to share their information with others. The consent should state what information is to be released, to whom the information should be given, and any applicable time limits. So you may want to, you can share health information, but please do not share any results of tests with so-and-so. It could be something like that. Please give them only general information. Something like that could be stated in there. Certain information is exempt by law and must be reported, and these are births and deaths, injuries caused by violence, such as assault and battery, abuse, or stabbings that may require police involvement, drug abuse, communicable diseases. Now, communicable diseases are on there because they can be spread very quickly to others, and we don't want that to happen. And then also sexually transmitted diseases. So this is something you will have to remember. Healthcare records are considered privileged communications. They do contain information about the care provided to the patient. So, is the patient allowed to see their healthcare records? So let's say I am working with a patient and I just think he's kind of grumpy and rude. He's very short with me. And so would I put in his healthcare records that the patient is grumpy and rude and very short? So I would not put that in the healthcare record because that has nothing to do with his health information and is not needed in the record. And also knowing that the patient could read that, that's not something you would put in the healthcare record. Now, what if I put in somebody's healthcare record that patient is non-compliant with his HEP, which is his home exercise program, because he thinks he knows more than the therapist and is not following directions? So that's a trick question. I can certainly put in the healthcare record that he's not compliant with his home exercise program, but I don't want to imply or say that because he thinks he's better than me, because I don't know that. Even if he says it, I wouldn't put it in there. I would just say that patient's non-compliant. I might say, though, that patient's non-compliant with his HEP because he did report an increased pain of 10 out of 10 when performing exercises. That is certainly okay to put in there because it states why he's not doing his exercises, and it's an objective reason as to why he's not doing them. The healthcare records do belong to the healthcare provider, but the patient has a right to obtain a copy of any information in the record. So yes, a patient can read their own healthcare records anytime they choose to. And they can also be used as legal records in a court of law. So it's often said in the healthcare field that if it's not documented, that it was not done. So let's say if I go to court in 5 years for my patient Henry, I'm not going to remember what I did with that patient unless looking through my notes. If it's not in my notes, I can't say, sitting on the stand, I gave him an aspirin on Tuesday at 3:40. because how are they going to know that that's right or not? Because it's not in there. So documentation is so important in the healthcare field. If you do anything with any patient, you have to document it, because if it's not documented, it was not done. Erasers are not allowed for the healthcare records because it is a legal document. So if you are writing in a healthcare record and you make a mistake, which just certainly could happen, you cross it out with just one single line so that you can still read what's there. And then the correct information should then be inserted, initialed, and dated to show that you're the one who made the change and it wasn't another person who was changing your notes. Most records are now on the computer, and once it's submitted, you usually cannot go back and delete or add something to it, because again, that would be kind of like erasing information that occurred. So you can do, when I was working, we had different types of notes. That if we made a mistake, we would put in a certain type of note. Sometimes it could happen that you would document under the incorrect patient. So if that was the case, you would insert a certain type of note that had a certain name to it, and you would say that this documentation was recorded under the incorrect patient and does not pertain to this patient. Or if I had seen a patient and did all my documentation for the visit and sent it in, and then maybe like 2 hours later I was like, man, I forgot to put this in, then again I would make a certain note for their record and put in what I had forgotten to do. So even if it's on the computer, you cannot go back and delete information. Must be properly maintained, kept confidential, and retained for the amount of time required by the state. So the state allows or requires that a healthcare record is kept for a certain time. So maybe it's at a doctor's office, the patient has stopped going to that doctor and has gone to see a different doctor, maybe that patient has passed away. It still has to remain there for a certain period of time, and then once they're done, they can get rid of it, but it must be disposed if it's a paper copy. It needs to be burned or shredded. It should not just be put into the dumpster, because again, you're allowing other people to see their information that is not supposed to see it if you put it into the dumpster. Chapter 5 workbook pages. We have talked about questions 1 through 13 right now, so you can work on those. The wrongful death lawsuit paper is due on Thursday. You can email that to me. You can submit it through Google Classroom. Would probably be the easiest ways for you to do it. And also, you can continue reading in the book, chapter 5, section 2, and section 3 for tomorrow. There are computerized records. Like I've said, most records are on the computer now, and they have created a dilemma in maintaining confidentiality. So safeguards have been created to maintain confidentiality. They limit personnel who have access to such records. They require the use maybe of an iris scan or a fingerprint, or they use codes and passwords to prevent access or to access to certain information. So when I was working in home care, the only patients that I was able to look up were patients that I was currently seeing. So if it was within the certification period, which for home care was for 3 months, and I discharged that patient 2 months into their certification period, sometimes I could still go back and look at their record to see how they were doing. But if it was into a new certification period, then that patient, I had no access to that patient to even look at their record. So if you're working at a hospital and you find out that Aunt Susan is in the hospital, you're not able to look up her record on the computer there. You may be able to look it up. You may have access to it, but you should not be looking at it because if you are not involved in her care, you should not be looking into that. So if the hospital went back to look to see different places that you were looking at, and they saw that you looked at somebody's chart, then you could be in trouble for that if you were not working with that particular patient. Excuse me, sorry. Okay, and healthcare agencies constantly monitor and evaluate computer use to make sure that people aren't looking where they're not supposed to. So can medical offices charge patients a fee for a copy of their records? And yes, they can charge a fee. And they're basically just charging for like the materials and the time spent for making a copy of it. Okay, so there's Health Information Technology for Economic and Clinical Health Act, which is otherwise known as the HITECH Act. And it was made in 2009 under the American Recovery and Reinvestment Act. The purpose is to promote the adoption and meaningful use of health information technology. The Office of the National Coordinator for Health Information, or ONC, was authorized to establish programs to improve healthcare quality, safety, and efficiency through the use and transfer of electronic health records in a secure network exchange. So with most health records being on the computer, it is a concern. Of course, there's hackers that people can hack into them, but it is a concern to make sure they are kept secured. ONC established a National Electronic Health Record Exchange called Health Information Exchange, or HIE, that is being developed with the help of government funding, so they are still working on it. It allows all medical facilities to electronically transfer and receive patient electronic health records. So this is really nice and helpful. So let's say here in Shiawassee County, just because I live here would not mean that I only see doctors who are affiliated with Memorial Healthcare. So I may see some doctors at Memorial Healthcare, but I may have to see a specialist in Grand Rapids. I may have to see another specialist in Ann Arbor. So by having the healthcare records electronically, we're able to transfer records quickly from one facility to another, which is nice. It's a greater degree of patient safety with quick access to medical history and lab tests. It can also, it's better coordinated care across different healthcare facilities and across different levels of specialization within those facilities. And there's also patient access to electronic health records and information for research and public health monitoring. Many doctors' offices have patient portals on where you can look on the patient portal and then you can get information about your labs. It can also reduce healthcare costs by eliminating repetition of the same tests in different facilities. So let's say I have an MRI here in Owasso at Memorial, and then I have to go to Ann Arbor, and they can look at my MRI that was done here in Owasso and determine that I may not need a second one there, that they can use the one that was already used, which obviously will save money. There are problems with it though. The system, all facilities have to use compatible software that can interpret the information, and there's policies and standards that is still being developed to solve this communication problem. A biggest challenge is keeping the transferred information secure. If the networks for all transferring facilities are not secure, then the security of the healthcare record can be compromised. Again, you don't want that to happen because you don't want others to see the healthcare records of other people. And this is something that they will continue to work on. So here's a little about information about kidney dialysis. The next video, the next screen is a YouTube video about a gentleman that has been on kidney dialysis for 5 years. Now with kidney dialysis, once you're on it, usually on it for life. It's very time consuming. You usually are on it for 3 days a week. So it's usually Monday, Wednesday, and Friday, or Tuesday, Thursday, and Saturday. And you usually go for roughly 2 to 4 hours at a time. And after you're there, you're pretty exhausted and tired after doing dialysis. So definitely your life rotates around your days that you're on dialysis. Family events or other activities that you might want to plan is all rotated and geared around your kidney dialysis. So this particular man, he's been on the kidney transplant list for a while, has not yet gotten a kidney transplant. So he is researching the black market to buy a kidney from another country. So he mentions in there's a risk, but if you have the money and you want to take the risk, then it's a good idea to do it. So again, after watching the video, we talked about different risks that were involved with buying a kidney on the black market. Obviously, if someone's selling a kidney, then it's illegal. So they may not be the safest person to buy the kidney. Heck, you could go there, you could pay your money for your kidney, but maybe there's a higher bidder and they want your kidneys for you. So what do? They may take your kidneys instead for more money. And how do they get the kidneys from people? Is it somebody who died naturally, or is it somebody they killed to get the kidneys from? Is it going to be sanitary? Are the kidneys going to match you? Are they going to be the right kind? Obviously, the doctor or the nurse, this is illegal for them to do also. So is that going to be done in a hospital? So is it going to be sanitary and safe, or are you going to get a bigger infection when you leave? Also, with when you have a transplant, you do have to be on lots of medications afterwards. How are you going to continue to get this medication? Are you going to have to continue going back to that country to get your medications refilled? Because an American doctor is not going to refill that medication because they don't know that you had that kidney transplant out of the country. So there's a lot of questions to ask. Again, is it fair for the kidneys, for somebody to buy kidneys? Is that fair? Is it right? Is it right to go to a different country just for a organ transplant? So again, questions for you to think about. But also looking at it from the guy's standpoint, he's tired of it. To him, it's a waste of time to sit in that chair 3 times a week for 4 hours for the last 5 years. He would rather be out doing more. He's desperate too. So is it right? Is it wrong? You decide and you think about it. So if you have any questions, feel free to give me a call. You can email me or text me, and hope you have a great day.